Awesome. Thank you. Next is doctor is asking, what medication do you add to the bone graft when you are, when you're doing the bone graft? You mentioned a medication. What's the name of that medication that you like to add to your bone grafts?
Perfect. So we are adding an antibiotic called metronidazole. By the way, it has no scientific basis. There's no research on that. I've just been using it for a long time. I found that when I use them, I get less voids in the sinus, less bubbles, and less infections. But hey, the infections are going to happen at some point. You're going to have some problems. It's just the nature of surgery. That's where you sign on the dotted line to perform surgery. You get your patient's trust. It's a privilege. So you're going to have those complications. The problem is not the complication. The problem is how to manage them and how to manage them predictably, quickly, and swiftly. And with the sinus lifting, you got to go in there right away. So I call my patients the same night. I call them 2 nights later. If they're asymptomatic and comfortable, great. But if they have pain and more than 2-3 days, I get them back into the office. I monitor them visually. I look for vestibular swelling, palpation. I see if they're sick, if they have like a discharge from the nose or anything like that. If I'm suspecting an infection, I may do a CT scan. But if there is no infection, if there's an infection, I go back in there and remove the graft, and that resolves the infection.